Penn State has identified 80 students who could potentially be carrying the disease, and those students are now being closely monitored. 6 News reporter Erin Calandra is live with the details. Erin?
Jen, there are 80 students, and that's all across Penn State's campuses throughout Pennsylvania. About half of them are here at University Park. The university says they identified them through student visas. They have contacted them, and now they're watching and waiting. Horrifying images of the deadly Ebola outbreak in Africa, where more than 2,600 people have died from the disease. Officials are calling it the worst epidemic in history. Now, Penn State University confirms they've identified 80 students through student visas who have visited Africa recently and could potentially carry the virus.
When we did our assessment on these students, we didn't find any of them that were at high risk or low risk. So all of them were, according to CDC classification, no known risk.
University health officials say they've provided information about the disease to these students and have asked them to self-monitor.
If you develop a fever greater than 101.5 or any of the symptoms of Ebola, and we gave them information about that, that they should call.
Officials say the incubation period for Ebola is only 21 days. University officials say most of these students have been back in the U.S. longer than that, so they feel the chances of them actually carrying this virus is very slim.
Not based on just leaving their country.
Mount Nittany Health System's infectious disease expert Evan Bell says even if someone does come down with Ebola, we likely won't see an outbreak like the one overseas.
The healthcare practices in the countries where and the regions where it is occurring are not up to the standards here of the United States.
But he says if someone does fall ill, Mount Nittany Medical Center is fully capable of treating this illness.
We're aware of the disease, and even before this disease was reported upon, we had mechanisms in place to protect the community and protect the patients.
Again, experts feel the chances of these people actually falling ill are very low. Now, Ebola is spread from person to person through bodily fluids, but it is not transferred as easily as other illnesses such as the flu or the cold. Live in State College, Erin Calandra, 6 News.